Okay, so you can do the back in different ways, either by doing it as the lower back and glutes as one section and then moving on to the upper back, or sometimes I'll do all of the left side and then when I've done that I'll move across and do all of the right side, or sometimes I'll just do the whole back and I'll move across and round the table as I need to. But for this video I'm just going to do the left side first. So I start off with some Effleurage on this side of the back, gradually increasing in pressure and then using the other hand for a bit of reinforcement, small sections, working my way up through the back, following the medial border of the scapula over the upper trapezius. Starting now to just go across the fibres a little bit as I do it. And you'll see the colour now starting to come in. So again, medial border over the upper trapezius. I can feel there's some trigger points there, which I'll come back to later. Now, for the lower back, I'm going to use my thumb and the other thumb on top, and I'm going to push in to where the quadratus lumborum is, feeling the length of that muscle. So I'm using one thumb on top of the other, again to feel the tightness there. I'm going to try and get in right from the iliolumbar ligament, using my thumbs going down, can reinforce that again, following the iliac crest, just for a small section, and then coming back in to the deep stroking movements. For the lateral border of the scapula, again I'm going to use my thumbs. My fingers, I try and almost pull the scapula, the medial borders with my fingers, pull across slightly, then get my thumbs underneath the lateral border, again in a small section, so the fingers pull and the thumbs are pushing in and up. And now I'm going to change my position. I'm going to use some reinforced thumbs, so again work up between the spine and the medial border of the scapula. I'm just going to move the hair out of the way, and I'm going to use my thumb and push into the upper trapezius. Again, I can feel those trigger points in there, so I'll come back to those later. Now again, I'm going to use my hand here across the scapula to push it across to get my fingers now underneath that lateral border. And again, I can pull that. And if you find that difficult, you can just use one hand on top of the other, reinforced. And again, I try and use my finger a little bit more there with some reinforcement to pull it towards me. Back to a bit more with the thumbs just to give that area a break. And again, I can go across the fibres, so doing small movements going across, working up the spine. And then when it comes to the upper trapezius, now I can do my trigger points again with a reinforced thumb, pushing down. I get feedback from the client on the pressure pain. And if that improved, then I would gradually hold that until it released. Again, use the thumbs, move my position again, and back to my effleurages to finish.